Bismillahirrahmanirrahim. Assalamu alaikum. My name is Ramsha Azhar. My roll number is BP1550142. Course number is PhD 705 and this assignment is assigned by respected teacher Ma'am Shahana. The drug name which I was assigned is p-amino salicylic acid. This is the structure of my respectable drug. Now the introduction. Basically, para-amino salicylic acid is found in synthetic origin or in synthetic form and it belongs to amino hydroxybenzoic acid. The molecular weight of para-amino salicylic acid is 211.20. Its pK value is 3.2. Now the indications. Para-amino salicylic acid is primarily indicated in conditions like multi-drug resistance tuberculosis. It is basically the drug of TB. Now the pharmacokinetics, volume of distribution in the body is found to be 0.241 per kg and plasma protein binding is 50 to 75%. As you know that every drug has particular plasma protein binding, its capacity to bind with the plasma volume of our body. So the para-amino salicylic acid volume is 50 to 75%. It can be easily combined to our plasma protein. The renal excretion accounts for 14 to 35% in unchanged form. 50% metabolite and plasma half-life is 60 to 65%. Now the contraindicated. Every drug has indication and contraindication. So the para-amino salicylic acid is known to interact with other drugs, especially with rifampicin and propionic acid or rifamycin. So these are certain drugs which can easily interact with the para-amino salicylic acid. Now the dosing. The dose which we are assigned as a pharmacist, we should give or we should be give to our patient. So the adult dose which is 10 to 12 gram single dose. Acha, don't take it frequently. It should be taken as recommended by a physician. Route should be per oral daily in 2 to 3 divided dose. In pediatric and neonatal form, or the dosage is not given and no data is available of TB drug in these two kind of group of people. High risk group. Basically, as you know that every drug has its side effects. So the high risk group which is most capable or which is more intolerance for this disease or the drug should not be given to pediatric. You can easily think that it should not be given to children. As we can say, TB is not common in children. It is very common in old age people or in the smokers, but it is not common in children. So the drug should not be given to children, in pregnant women or lactating mother, cardiac problem patient and hypersensitive patients suffering from kidney dysfunctions too are very high risk on this. If we are giving to those patients, because हमारे पास ऐसे patients आते हैं कि जिनको cardiac problem है, hypersensitive issue है या kidney disorders हैं, तो उन cases में हम ये drug बहुत precautionary देते हैं. ठीक है, तो उन केसेस में हम बहुत देखभाल के प्रिकॉशनरी ये ड्रग्स देते हैं क्योंकि उसके साइड इफ़ेक्ट होने के चांसेस फिर बहुत ज़्यादा हो जाते हैं. फिर आगे हमारे पास मोड ऑफ एक्शंस. 4-amino salicylic acid has been shown to a prodrug and it is incorporated into the folate pathway by dihydropyridine synthesis and dihydrofolate synthesis to generate. Why these two? Because it helps to generate a hydroxy dihydrofolate anti-metabolite which in turn inhibit dihydrofolate reductase enzymatic activity. Are you getting? Now the rational use and the irrational use. 4-amino salicylic acid, also known as para-amino salicylic acid PAS, are sold under the brand name PASER. Among others is an antibiotic primarily used to treat tuberculosis. It has also been used as a second-line agent to sulfasalazine in people with inflammatory bowel diseases or ulcerative colitis and Crohn's disease. Irrational use include ulcerative colitis, Crohn's disease, and also for the treatment of inflammatory bowel disease. Also used in magnesium chelating therapy. So now the most important thing is that side effects. As you know that every drug has side effects, every drug has its good effects, so it has side effects. So the side effects include a para-amino salicylic acid is irreversibly adverse effects are complications including hepatotoxicity, as I told you before, pulmonary infiltrations, rashes on the skin, conjunctivitis, eosinophil hypersensitive reactions, fever. Para-amino salicylic acid produce potentially life-threatening effect which include hepatotoxicity or liver toxicity. It can be a life-threatening. Necrosis, granular degeneration, fatty vascularization, which are responsible for the discontinuation of para-amino salicylic acid therapy. Now brands available in Pakistan are mostly जो brand हमारे पास पाकिस्तान में मौजूद हैं वो हैं PAS सोडियम शुगर कोटेड टेबलेट, मेसालामाइन प्रोलॉन्ग रिलीज टैबलेट एंड मायोब्यूटॉल. सो ये हमारे पास कॉमनली ब्रांड्स मौजूद हैं. इसकी मैंने आगे आपको पिक्चर्स भी स्पेसिफाइड कर दी हैं. दीज आर कॉमनली प्रेजेंट इन पाकिस्तान. Now the case study of tuberculosis. Subject evidence. The patient name is Naila Hussain. Her age is 58 years. Gender is female. Ward is general. And the date of admission is 24 January 2021. And date of discharge is 29/1/21. Consultant or her doctor is Dr. Ali. Now objective or reason for admission of that patient. Because she is having the cough since from 1 month, SOBs for 15 days, fever, headache and body pain, and anoxia for 1 month. Past medical history include hypertension, diabetic mellitus. Past medical history not under our personal history bill, nil yani. And family history is not known. Assessment. What we have diagnosis. Basically, based on the subjective and objective evidence, the patient was a known case of hypertension and diabetic mellitus and newly diagnosed as TB. इस patient को already hypertension है, diabetes है और अब इसको TB भी diagnose हो गया. Basically, which we have assist. Now planning, how to manage. This is the drug chart which I have found from a source and I am sharing it here so that I can explain clearly. As I told you before, the drug which I am using, commonly the brand name is Alphamac or Flexin. The dose is 200 milligram. इसके अलावा we are using Rifampicin, ethambutol 400 milligram. और पैरासीटामोल, मेटफॉर्मिन, पेंटोपेराजोल 40 milligrams. These are certain drugs which we are using, which are prescribing to our patient in certain dosage form, and how frequently the patient should take. So this is the drug chart which clearly explain whole drug activity or drug which we have prescribed. Now the डिस्चार्ज मेडिकेशन. अच्छा, ऐसा नहीं है कि पेशेंट को हमने अभी ड्रग दे दी है तो हॉस्पिटल में जस्ट ट्रीट करके वी कैन गिव हिम और वी कैन गिव हर रिलैक्सेशन. नो, डिस्चार्ज मेडिकेशन which we have suggest must be followed by the patient for total recovery, which include T for shocks or pyrazinamide 750 milligram, Rifampicin 22 to 25 milligram, paracetamol, metformin in these dose which we have prescribed, which I have given in this chart. So the patient should have to follow this for the complete releasable or the complete treatment of the disease. Pharmacist investigation. अच्छा, ये बहुत important है pharmacist investigation, क्योंकि as we know that we are basically giving the authorities to patient को बताने के लिए कि भाई how you have to take the medicine, how you have to take it with water, take it with any other or after meal, before meal. So this is the duty of a pharmacist. So the pharmacist should have idea about the investigation or drug interaction of that particular disease. Now in TB, drug interaction include olfacin plus metformin, इन दोनों का interaction हो सकता है. Concurrent use of fluoroquinolones and antibiotic agent may result in changes in blood glucose level and increased risk of hyperglycemia or hypoglycemia. Now the clinical management. If concurrent therapy with the fluoroquinolones and anti-diabetic agent is necessary, closely monitor the blood glucose level and adjust the dose of the anti-diabetic agent as indicated. ज़ाहिर है दवा तो हमें देनी है पेशेंट को टू ट्रीट. सो हाउ कैन वी ट्रीट दिस? तो उसके लिए हमें ये करना होगा कि हमें एंटी डायबिटिक एजेंट जो हम दे रहे हैं उसको मैनेज करना होगा इस तरह से कि वो हमारी रिस्पेक्टेबल ड्रग जो ट्यूबरक्लोसिस के हम दे रहे हैं उसके साथ इंटरेक्ट ना करें. So dose adjustment may be required after discontinuation of fluoroquinolones. If hypoglycemic reaction occur, the patient should initiate appropriate therapy immediately. Discontinue the fluoroquinolone. I hope you are getting my point. Now severity as it is measured. Paracetamol plus isoniazid concurrent pace of acetaminophen and isoniazid may result in increased risk of hepatotoxicity or liver toxicity. Clinical management use cautions with concomitant administration due to the potential of isoniazid to induce cytochrome 2E1, which may increase exposure to toxic acetaminophen metabolism. Acetaminophen use should be avoided or limited in patient taking isoniazid. Severity major. Now the patient education. This is the very important thing which a pharmacist should have to do. What we are actually assigned to, we are not actually treating the patient, we have to give them education, counseling, how to take the medicine, how to overcome the disease, because the medicine is already given by the physician. The disease is already curable by the physician. The physician is already treating this disease, but the patient should consult their respective pharmacist for further counseling of their further education. कि किस तरह से हमें अमल करते हुए इस बीमारी से निकलना है. तो ये बहुत इम्पॉर्टेंट है एक पेशेंट के लिए कि वो प्रॉपर काउंसलिंग करे अपने फार्मासिस्ट से. सो इन द केस ऑफ ट्यूबरक्लोसिस इज़ अ कम्युनिकेबल डिजीज़. जैसे कि ये फैलने वाली बीमारी है. इट कैन बी फ्रॉम पर्सन टू पर्सन. So tuberculosis is a communicable disease which is spread through the droplets of the infected person, characterized by the persisting cough with sputum, sudden weight loss, loss of appetite, chest tightness and pain. Diabetic mellitus, as you know that the patient is already suffering from diabetes and blood pressure, hypertension. So diabetic mellitus is an endocrine disorder which is characterized by hyperglycemia, frequent urination, excessive thirst, excessive hunger, and then other is hypertension is persisting elevation of arterial blood pressure. So these are the education or knowledge which a pharmacist must guide their patient. Patient counseling is a very important thing for a pharmacist to do. How to consult, how to treat, how to give the patient, how to treat the patient, how to counsel the patient to recover from the disease. Is isolate the patient in a separate place. That is, tuberculosis is a transmitted disease. It's a communicable disease. It can easily spread. So the patient should be isolated in a separate room or separate room of hospital or house, anywhere. Advised to wear the face masks, maintain hygienic environment, restrict salt usage, avoid sewage, take brown rice instead of white, take medication without skipping dose. ये बहुत important है. If the patient, अच्छा अब इसके जो नेक्स्ट पॉइंट है, एनी डोज स्किप, नेक्स्ट टाइम डोंट डबल द डोज. हमारे यहाँ होता ये है कि एक दफ़ा फॉर एग्जांपल द पेशेंट हैज़ मिस्ड द मॉर्निंग डोज, तो वो डबल ले लेंगे आफ्टरनून में. दिस शुड नॉट बी डन. इफ़ एनी डोज स्किप, नेक्स्ट टाइम डोंट डबल द डोज. डू रेगुलर एक्सरसाइज. इफ़ यू हैव एनी डिजीनेस, इंजरी, इमीडिएटली कंसल्ट योर फिजिशियन, बिकॉज आप ऑलरेडी इस वक्त एक थेरेपी से गुजर रहे हैं. तो अगर आपको कोई डिजीनेस महसूस हो रही है, किसी तरह की वीकनेस है या इंजरी हो गई है, तो आपको फ़ौरन फिजिशियन को दिखाना चाहिए, क्योंकि हो सकता है कि इट कैन बी और द कंडीशन कैन बिकम वर्स्ट. यूरिन में पास्ट ऑरेंज कलर ड्यू टू रिफेपेंसिन. ओके, नाउ दीज आर द रेफरेंसेस फ्रॉम वेयर आई हैव जस्ट प्रिपेयर्ड माई असाइनमेंट. These are above there are giving the links and below there are some books which I have taken it basically from different books. I've just read the topics and what I should have to take, I just take that part, and I've just mentioned my all references in one platform. Thank you. I hope you just get my point, or what I have told is clearly described. Jazakallah.